Hello friends, welcome to all of you. Today our topic of discussion is acute management of myocardial infarction. We know that MI is of two types. One is ST segment elevation MI, also called as STEMI, and another is non-ST segment elevation MI, also called as nstemi. The difference between the two STEMI and nstemi is that in STEMI, suppose this is the coronary vessel supplying the heart. In STEMI, whole of the coronary vessel is thrombosed and whole of the heart vessel is necrosed. While in nSTEMI, there is partial thrombosis of the coronary vessel and there is partial necrosis of the heart muscle. The immediate management of both STEMI and nSTEMI is similar. We give the patient morphine. Morphine, you all know that it is an analgesic. It reduces the chest pain. It also reduces the pulmonary edema and it also reduces the size of the infarct. Very important point. Then we oxygenate the patient. We also give nitrates to the patient. We give nitrates in the form of nitroglycerin tablets. The route is sublingual route and the dose is 0.3 milligram. And maximum we give 3 tablets, and each tablet we give are 5 minutes apart. Then the mechanism of action is nitrate is that it reduces the preload and it reduces the afterload, and it also dilates the coronary vessels that supplies the heart, and in this way it reduces the ischemia to the heart. Then we give aspirin to the patient. Aspirin come in the form of tablets. We crush the tablets and give it through mouth. The aspirin, you all know that it is an antiplatelet drug and it prevents the clot formation within the coronary vessels, and the dose of aspirin is 325 milligram. And as soon as you suspect MI, you must give aspirin, since it also reduces the mortality in such cases. Then you can remember these drugs by mnemonic MONA, where M is morphine, O is oxygen, N is nitrates, A is aspirin. After the immediate management, you give adjunctive treatment to the patient. And in the adjunctive, the drugs you can give is IV beta blockers. You also give IV nitrates, and you also give IV heparin. One thing you have to note here is that MCQ asks regarding which drug is not given in MI for the acute management. The drug is warfarin. You cannot give warfarin for the acute management of MI, and also there is another drug which you do not give for the acute management is plasminogen activator inhibitor. You give plasminogen activator, but you don't give plasminogen activator inhibitor. These two drugs you don't give for the immediate management of the MI. Then now the specific treatment of STEMI and nSTEMI. We are going to discuss STEMI first. In STEMI, if the person or the patient present within less than 12 hours, you have two options. Either you go for percutaneous coronary intervention or you can thrombolize the patient. You have two options, and among the two options, PCI is always better than thrombolysis. Okay. Then in nSTEMI, you can do percutaneous coronary intervention, but point here to remember is that the thrombolysis is contraindicated in non-ST segment elevation MI. PCI you can do, but thrombolysis is contraindicated. You can't do. Thrombolysis is contraindicated in nstemi because if we thrombolize the patient of nstemi, then nstemi can convert into ST segment elevation MI. How? Let's see. Because if we thrombolize the patient of nstemi, suppose this is a patient of nstemi having a partially blocked coronary, when such patient are thrombolized, then this clot which is formed within the coronaries, it can dislodge and block the arteries or the coronary distal to it completely, and thus converting the nstemi into stemi. That's why we don't thrombolize the patient of nstemi. Now few points about thrombolysis. The most commonly used drug for thrombolysis is streptokinase. The dose of streptokinase is 1.5 million unit given over 1 hour, and it is given through IV route. And the mechanism of action is it causes fibrinolysis since it is a plasminogen activator. Then streptokinase, side effect of streptokinase is that since it is obtained from the microorganism streptococci, it can cause hypersensitivity reaction or anaphylactic shock, and it also, since it causes fibrinolysis, there is increased risk of bleeding, and it could cause brain hemorrhage leading to the stroke, increased risk of stroke, and it also causes fever, and it also causes hypotension, and it also causes arrhythmias. Then another thing about streptokinase, we cannot give 2 doses of streptokinase within the interval of 6 months. If you want to give streptokinase, you should give 6 months apart. Then now we are going to see the absolute contraindication of thrombolysis. Absolute contraindication of thrombolysis. Absolute contraindication: if the patient present after 12 hours, you cannot thrombolize the patient. And if there is intracranial malignancy, you cannot thrombolize the patient. And if there is aortic dissection, you can't thrombolize. If there is bleeding, that diathesis excluding menses, you cannot thrombolize excluding menses. Then if there is history of stroke within a period of less than 3 months, you cannot thrombolize the patient. Few important frequently asked MCQ regarding the management of MI. The best intervention for acute MI is PCI, percutaneous coronary intervention is the best intervention. And the best management for acute MI with cardiogenic shock, the best intervention is intra-aortic balloon pump. Intra-aortic balloon pump with PCI is the best intervention. And another thing, best management for inferior wall MI, or we can say right ventricular infarction, is the IV fluids.